Okay. My name is Kristen Rose, and I will be presenting the issues of patient throughput and some possible solutions. So what does patient throughput mean? Patient throughput is defined as the process of moving patients as efficiently as possible from outpatient beds to inpatient beds in the hospital. So basically, the time from when they're seen in the emergency department or have surgery, post-surgical beds, to inpatient beds, and then back out to home. So a little bit of background. So the number of emergency room visits has risen sharply at a rate of approximately 130 million per year. With this rise in emergency room visits, the amount of hospital admissions has also risen. Hospitals have been pushed to the limits to try and bed the increasing number of patients in a swift and efficient manner. The reasons for problems with patient throughput in the ED are physician shortages, longer lengths of patient stays, and slow lab and radiology testing. So often our hospital waiting rooms look like this, with almost every seat filled, if not every seat filled, waiting to be seen by a physician or even to get up to a bed if they've been admitted. So why is patient throughput important? Nationally, patient throughput is critical to ensure that no matter where a patient receives care, they can receive care. Patient throughput is not just a nursing issue. It is a hospital-wide issue that encompasses all different departments. And I found this little video that's pretty good about explaining how important that is and each person and their role in that. So I'm going to show this video.
This year, new standards have been introduced to improve the flow of patients through the hospital. How can you help unblock flow through a hospital and improve patient care?
I'm helping patient flow by making sure my patients are safe for transfer, including checking their paperwork property and making sure their next of kin are aware.
I'm helping patient flow by pulling patients through from ED as quickly as possible, using our ambulatory areas where possible.
I'm helping patient flow by making sure our beds are made quickly and efficiently for our new patients.
I'm helping patient flow by making sure that health of the ward is up to date.
I'm helping patient flow by responding to bed bookings and ensuring capacity on the assessment units.
I'm helping patient flow by booking transport early and setting patient out where possible.
I'm helping patient flow by making sure that my IDS is completed on time and I give nurses clear instructions for discharge.
I help patient flow by screening prescriptions to make sure that medicines are safe for patients and by checking medication on discharge so that it's ready to be.
If we don't work as a team, poor patient flow blocks our specialty beds from delivering treatment to our haematology patients.
If we don't work as a team, poor patient flow blocks us from operating on our patients.
If we don't work as a team, poor patient flow means we're unable to discharge patients to the ward. This in turn could stop us from delivering life-saving treatment.
If we don't work as a team, poor patient flow can mean our department becomes dangerously overcrowded and we can no longer treat our patients.
Poor patient flow means that we can't hand over our patients in ED. This means that we have to wait within the corridor rather than responding to 999 calls.
Every member of staff at every level of the organisation has an absolute fundamental role to play in managing patient flow, from the cleaner, ensuring the room is ready, to the consultant making that tiny decision about discharge. So getting our patient flow right, that means right patient in the right bed at the right time, is absolutely crucial if we are going to deliver optimum safe care. For me, patient flow transformation is teamwork.
Safe care.
Safety. Getting patients home.
Dignity.
Teamwork.
Patient choice.
Communication.
Flexibility.
Dynamic actions.
Nursing in an appropriate environment.
Patient choice.
Giving care in the correct setting.
So those are just some examples of why each department is super important to helping patient flow. So why is it an issue? Personally, patient throughput's important because when myself or a loved one needs hospital care, I want them to be able to access that care in a timely manner. I know as a nurse that if people don't get the care in time, they can have adverse outcomes or even die. Express admissions unit. One thing our hospitals tried with some success is an express admissions unit. We have 12 beds on the 8th floor where the patients go after they receive an admission order to start some of the testing and the processes for admission. Instead of sitting in the corridor or the hallways in the patient areas of the waiting room. So does it help? So we have had some success with this. Some of the pros are that the patients are not waiting in the corridors for a bed. Their admission process can begin so the patients receive care faster. For example, if a patient has an order for an antibiotic, they're able to go ahead and get that antibiotic started. One of the barriers we found is that the charting system or the electronic health record in the ER did not communicate well with the inpatient version of that software. So the nurses in the ER were only able to initiate, I believe, 2 orders, so a limited number of them. So that really was preventing them from getting care very quickly. So this has helped with that. It also helps to decompress the ER just because there are not as many patients and visitors waiting down there for beds. Some of the cons of this express admissions unit is that patients are often moving from a private room in the express admissions unit to a semi-private room for admission. Patients don't like that typically. Also, they don't like changing rooms so often. That's been one of the complaints that we've received is they don't like being in so many different rooms. And also, I feel like the more moves a patient has, it just becomes easier for their belongings to get misplaced. So another study that I read examined the impact of an ED flow coordinator. The hospital that was used for this study did show some improved patient flow with the ED flow coordinator. It basically allows them to decrease the amount of downtime in the ED where the patients are just waiting for testing or assessments to be completed so that an admission decision can be made. So can it help? The results of this study showed that the length of stay in the ED decreased by approximately 5 hours per patient. So that is a big time savings there. And then also, as an indirect effect, they found the likelihood of ambulance diversion decreased approximately 39% in a 24-hour period. As far as cons, they found there was not much impact to the patients waiting in the waiting room. So what does the future look like? If the number of people seeking healthcare in the hospitals continues to increase, further creative solutions will be necessary. The infrastructure of our current healthcare system cannot sustain yearly increases at this rate. One of the things that I have observed personally in our hospital is that people are sicker than they have previously been. And that leads to more complex care. And longer hospital stays. Patient throughput is plagued by barriers of inefficient operational planning, not enough staff, a lack of standardized processes and routines, and insufficient IT support systems. We have to figure out a way to break down these barriers to improve patient flow. In the article that I read about some of the barriers to good patient throughput, I found this image, which I felt was a really good visual display of where the barriers are. So we've got entry barriers. So we've got some barriers for patients coming from the outpatient clinic. We've got barriers in pre-op, internal barriers within each unit or area the patient may be. There are transfer barriers, so barriers in between places. There are management system barriers that really encompass everything. And then we have the discharge barriers that impact the patients going from our inpatient beds to home. So there really is a lot of room for us to view and kind of figure out which piece of the puzzle we need to really focus on. So thank you so much for listening to my presentation. And that's it.